Guys, and welcome back to my channel. It's your girl Tatiana Duh, and I'm back with another video. If you are a returning subscriber, hey, and welcome back to my video. If you're new here, hey, my name is Tatiana, and I am a second quarter nursing student. I'm currently taking Pharm 2 fundamentals with the skills lab, and I'll be doing my first clinical rotation. So this is going to be a week in the life of a nursing student because it's going to be test week. So I still have my first quiz this week, so I'll just let you guys see what that's like preparing for that. So just stay tuned for the video. Don't forget to subscribe and like while you're here, and I hope you guys enjoyed the video. Hey guys, all right, so today is test day and I'm getting ready for it. I did come home to get me a little nap because I worked last night, but just follow me while we head to class. Getting ready. Okay, so right now I'm trying to get in the car, but it's so foggy outside I couldn't even see Jesus coming. So but yeah, I don't know why it's so foggy like this, but that's something. But I am nervous. Well, I wouldn't say nervous per se. I'm just kind of like, we'll see after the test, but I feel like I'm ready. I feel like I'm ready for it, ready for the quiz. We have a quiz, and then typically after that, she doesn't show us our actual grade itself. But I am going to head to class, and then I'll pick up from there once I'm in class itself, get prepared. So yeah. Okay, so I am here in class, and I'm just waiting for the rest of my cohort to get here and my professor so we can get started for the quiz. So yeah, I'll let you guys know how the quiz go. Hey guys, so it is the next day, and I did get my results back for my for my quiz, and I did make an 88. So yeah, we have we have the exam coming up, and then we have another quiz for our first quiz for Pharm. So next time you see me, we'll be studying. So I'll see you guys then. Hey guys, so I am back. I know you like new hair. Who this? Yeah. Yeah. Let's get into it. I know, right? But I am back. So I know the last clip said that we're going to be studying and preparing for exam 1, which is in tomorrow morning. Yeah, it's literally tomorrow morning, y'all. I can't. Time flew by. So what I'm gonna do is, I have an ATI that I gotta do first. So I'm gonna do my ATI first, and then I'll kind of show you guys some clips of my ATI, how that goes. And then after that, we'll just kind of, I guess, get kind of organized and ready for how I'm going to prepare for the exam for fundamentals and my quiz 1 for farm. So I did pretty well on the fundamentals quiz one. So I'm hoping that transitions over to exam one. And I hope I do well on the farm one quiz. So we have two exam and a quiz tomorrow. My first one up is going to be fundamentals, and then that afternoon is going to be farm. So I'll take you guys along with me with that. Typically with the exam, I'll find out that same day, but for my quiz, I'll find out probably that next day. It just kind of all depends, but that's just how it's been going. So let's get into it. All right, so we're going to log into ATI and look and see what ATI is that I have done. I think it's endocrine. But I think that's the ATI that I have due. But yeah, if you haven't already, don't forget to like this video. So it can get to, you know, more, it can be more recommended to, you know, other people that's, you know, in nursing school or about to start nursing school. A lot of this stuff that I'm showing you guys is literally going to be a part of your day-to-day stuff that you're going to be doing as a nursing student. So don't forget to like, and also don't forget to subscribe to my channel, you guys. All right. Oh, and don't forget, once I reach 800 subscribers, I will be giving away my pink Litman in my nursing school supply haul, along with other items that I think you can use for nursing school. So if you're interested in that, let's get that subscriber count up to 100, y'all, so y'all can get this box of these goodies. So yeah, so just follow along with me. And we're about to go ahead and get to the ATI. And I guess while I'm doing ATI, I kind of do like a little, you know, I guess y'all are just gonna hear me talk, but it's gonna be all good stuff. So yeah, follow me as we go to ATI. I'll see y'all over in ATI. Okay, so this is the ATI that I have to do. I have to stay on this ATI for an hour. And I'm not going to make you guys sit through this for no hour, because I can't make ATI that fun, because it's really not all that fun. But it does help. So I am going to go ahead and kind of go through the endocrine system ATI and just kind of go from there. There's not really much that I can really explain with ATI.
Welcome to the endocrine system module. In this module, you'll first learn about drugs that treat disorders that relate to the endocrine system.
Okay, that was loud as heck. But yeah, this is the like I said, this is the ATI. These case studies really do help when it comes to test time, when it's time for the exam. The case studies do help because it kind of breaks down everything in kind of like in an NCLEX style question type of way. That's the one thing about nursing school, is you're not going to get kind of like those basic questions that you got like you did in your prereqs. You're going to be really based off NCLEX style questions. So that's going to be the majority of the types of questions that you're going to run into. And you're going to run into things like select all apply. And yeah, because they're trying to get you to think like a nurse. So that's why these questions are set up the way that it is. But I'll come back to you guys once I am finished with this ATI, and then we'll from there we'll we'll turn in the ATI, and then we'll prep for the exam and quiz that I have for tomorrow. All right, I'll see you guys over there. All right, guys, so hey, I'm back. I just realized that I never gave you guys a tour of what my desk looks like. So I'm just gonna flip the camera around and give y'all a visual on what my desk setup looks like. So, okay, so this is a setup of what my desk looks like. So that is my calendar with all of my dates, my printer, my little quote that I have up there, like when you feel like quitting, think about why you started. I got it from Amazon. Then like this is my whole desk setup. So yeah, I have my different, you know, drawers and everything. Yeah, with all of my stuff in there, my printer paper, and you know, my books. And then over here, you know, I just have my extra stuff. But yeah, this is my setup. This is where I normally, you know, be at. Excuse kind of the mess. But yeah, I just wanted to just make sure you have your, you know, you a nice little setup so you could be comfortable as you. All right, so I'm back. So now I did get my ATI done, did turn that in. So now I'm just going to prep for my exam. I need to first look over what chapters what the chapters are that I'm going to be tested on. Right now what I'm going to focus on is going to be Farm 2. So it looks like we're going to be the quiz is going to be on chapters 26, 27, and 28. Those chapters consist of antibacterials, anti-tuberculars, antifungals, and antivirals, pesticides, anti-malarials, and something else. And something else I can't find right now. So, I'm gonna spend my time, preparing for that. I typically go back through the PowerPoints that I made while I was in class. Well, the notes that I made to the PowerPoints that I had wrote while I was in class that helped me with that. And then out of those notes, I just go and typically just take NCLEX style questions pertaining to you know, things like antibacterial, antifungals, so I can be, you know, prepared when it comes to test time. I might go on ATI and kind of make my own, but since the quiz is tomorrow, I typically am going to just go off my notes and then that I made from the PowerPoint, and then correspond that with the NCLEX style types of questions to kind of see what I need to brush up on or look under a little bit more. Yeah, I think the it just all depends. I might look at a couple of case studies too, but I don't want to overstudy for the quiz because it's typically only like between like 15-20 questions, so I don't have to go so deep into it. We'll have the exam the following week, so yeah. So I'm just gonna briefly kind of look over Farm, kind of fresh up on that, the different medications that pertains to, you know, the corresponding information. So yeah, so just bear with me as I study and everything for that. And yeah, once I get finished with studying for that, I'm going to go ahead and get ready for my week, because I do need to, we do have clinicals this week. We have clinical orientation this week, so I need to get like my lab stuff out my scrubs out for lab, and then I get out my other stuff for clinicals to make sure I'm on point for that. So the next time you see me, I'll be getting my stuff out and ready for that, and then we'll follow up from there. Hopefully I'll take you guys with lab with me when I go to lab for checkoffs. I think they were checking off on restraints, so I'm gonna go in the day before to kind of work on restraints, because as easy as you think restraints are, I don't know why it's just becoming a little hard for me to put on the restraints the right way. So I need to practice a little bit more. So that's the point of me going to lab, so I can brush up on that, so I can be ready for check off that following day. So I will see you guys when I am getting ready for my week. So just watch me study, I guess. Just watch me just study. If you want a more detail on how I study, you can just drop it down below, but just watch me go. Hey guys, so I am here at school, and today is exam day and exam and quiz day. I have an exam in fundamentals and a quiz in Pharm 2. Lucky me. And we're going to see how we're doing with that. We're gonna see how it goes, because honestly, I normally get bad test anxiety, but I take these distress pills that has been working miracles, so I'm pretty chill actually. So yeah, I'm kind of looking forward to taking the quiz and the exam to kind of see if the way that I'm studying is paying off. I did make a 88 on the actual quiz, so I am wanting to see what I'm going to make on the actual exam. Exams are way more heavier than the quizzes, so if I kind of apply what I did the first time, it should transition over, but you never know. It's nursing school. So the next time you see me, I will let you guys know how the test went, in my opinion, and whether I think I passed or not, because I'm not sure if she's going to display our answers. Not answers. I don't know if she's going to display our grades or not. But yeah. See you guys then. Okay, so on the written, on the dosage and calculations, I only got like 1 out of 6 right. I'm not sure about the case study, just like 10 questions, but I made a 78.33 on the actual online portion, so I'll see my final grade after she calculates that, and I'll let you guys know. Hey guys, so today I'm going to be going to lab to practice off skills for restraints. So before checkoffs the following day, and I'll take you guys to lab with me. So I'm going to be getting ready for lab, so just watch me get ready.
What I want, baby, dig deep, it's time to make a move on my heart. What's it gonna take for you to love, me? What's it gonna take for you to show feels, yeah. I've been trying to take it slow, but my patience low. Think it's time you let me know. What's it gonna take for you to love, me, yeah.
Okay, so now I gotta put my hair up in a ponytail. Cause I'm gonna eventually have to do it, put my hair up for lab. So I'm just gonna do it now. But before I put it up. I didn't. I haven't greased it or oiled it since I got it done, and that has been like a couple of days now. So I'm going to oil my hair, and then I'm gonna put it up in a ponytail. This is what I'm using, the Miel. So
One step forward, two steps backwards, yeah. Immature lover who don't use big words, yeah. I don't need convincing at all because I know what I want. Baby, can't you figure it out? What's going on in your heart? What's it gonna take for you to love, take for you to love me?
okay, guys. So I'm in the car and I'm heading to lab, so you guys can follow me while I head to lab. Like I said, we're going to be practicing. We're checking off tomorrow on restraints, bed baths, and I think it's some other stuff. Can't think of all of them off the top of my head, but I know the one that I need to practice is going to be the restraints. So that's what my main focus is going to be on. As far as bed baths, I'm pretty familiar with it because I am a CNA, so I'm familiar with how to give the different types of bed baths. So yeah, so just ride with me while we head to
The show, take for you to show feels, yeah. I've been trying to take it slow, but my patience low. Think it's time you let me know. What's it gonna take for you to love, take for you to love me? Yeah.
Okay, so I am in lab with my classmate Chastity. We are going to be practicing on how to do a complete bed bath and with linen change. Excuse my voice because as I'm doing this voiceover, I'm getting over a sinus infection. So if you hear me sniffling throughout this voiceover, I apologize. Um, so um, when you're in nursing school, I know each nursing school is different, but my school, we're able to go in lab and practice on our skills. When we can, when the lab is open for it. I highly encourage going to the lab to practice on your checkoffs, whether it's like something small. Like I said, for me, the checkoff that I had needed to practice with was uh, bed restraints because I couldn't get that slip lock down to save my life, y'all. I couldn't get it down. And for whatever reason, it just got so complicated. But I made it harder than what it was. And after I went to lab, I was able to get it down packed. So right now we're doing kind of going over what the bed bath is. And I'm kind of explaining the process of what a bed bath is with Chastity. We kind of talking through all of that. Yeah, I'm letting the bed up because I'm tall and sometimes I can't be bending over like that. I'm gonna hurt my back. So I be needing the bed at a certain height. So it's important. Don't hurt y'all back while y'all trying to do these complete bed baths. Cause So right here in this clip, I am folding this washcloth, not rag, y'all. Washcloth. On my hand this way because that's how you're supposed to do it, the right way. You want to do things the right way, but when you go out and practice, you're gonna see things done differently. But just do it the right way, y'all. Just do it the right way. So I'm just explaining, like you're supposed to go inward to outward. Um, Oh God, don't cover their face like that, y'all. I'm just talking about how you need to make sure if they have like a nasal, if they're on oxygen, to remove the actual nasal part and wipe around their nose to make sure you get all that mucus and everything up out of there, so that they can be able to breathe easy. So I'm gonna just practice, just showing how you would wipe a person's face and going from there. Um, bed bath, just follow your checkoff sheet for how to do the bed bath. I'm not going to go straight into detail. We're not doing things exactly, check off per check off for this bed bath. We're just touching on the important parts that we need to, as far as like right here, we have to make sure that this person has a bath blanket, so you can just cover them up for privacy, because you don't want them all exposed and everything, because it can be cold and you don't want your client or your patient to be, cold and uncomfortable as you're giving them this bed bath. So yeah, because can you imagine you trying to get a bed bath and you cold as heck? But yeah, I'm right here. I'm explaining why you have to um wipe upward for venous return, and then I'm explaining in here, like, just be mindful if they have like an IV to not get that IV site wet, because then it can turn into a whole different thing there. So just be mindful of that. And like I said, we're just, doing things, just touching on the important parts. Please don't be in the comments like, oh, why don't y'all have on gloves, blah blah blah. Like I said, this is just like this is our actual practice lab. We're practicing, so please don't come for me and come for us in the comments about that. Like I said, it's practice. We're coming in on our own time to do this, so yeah, we're just making it make sense to us. So when we actually check off for it, it can be a smooth check off for us, so we know what we're supposed to do and what we're not supposed to do. Like I said, again, this is just a practice run for us. Okay. So here I'm explaining that you need to be mindful if your patient has on TED hose, or any other ortho devices, to remove that out of the way so you can be able to clean the patient's leg, because you don't want to have a TED hose keep on a patient for 5 and 6 days or however long that patient is there and not change it. That's disgusting. You want to remove it, wash it, dry it, moisturize it well, and then, place that device back onto that patient, because that is very, very important. That helps with the skin integrity of the patient. But here I'm explaining, like, me, as being a CNA, I like to what I call pre-roll my stuff and have it already ready. I don't know why I didn't do this before, but I always pre-roll my stuff because it's easier for me to pre-roll. So instead of doing things one by one, I pre-roll it to whatever direction I'm at. I just take the draw sheet, fit the sheet, roll it up. Or if they had like a pad for them, I have that already rolled up on the chair ready. So when I just do it, all I gotta do is just boop, take it under there, push it, and now that's what I'm doing. Um, yeah, just be mindful of making sure that you don't get anything, you're dirty on your clean linen, because yeah, that's important, especially if you have a patient that has a bowel movement or something. You don't want that to get on your new stuff. So just be mindful of that. But like I said, this is just the easier way for me to do it. So yeah. um but yeah, and the whole process that you want to make sure you keep privacy of the patient, and obviously you do know perineal care is last. So here we're just putting back on the gown, putting the gown, the clean gown back on the patient. But yeah, and then we put on the fresh sheets and letting the patient back up. I think this particular patient is pregnant, if I'm not mistaken, y'all. So that's why it's like a little lump, because I think she's pregnant. So that's why she's like that. And also too, I forgot to mention, like, keep in mind you don't want to keep your patients laying flat, especially if they're on like oxygen or something like that. It's not good to keep the patient completely flat, so you want to have them like elevated up, and you just want to have them elevated up in a Fowler's or a high Fowler's position, like we're doing now, you know, just for patient comfort. But yeah, you want to make sure that the patient is good. Here I'm just explaining, like, if you're doing like oral care, to like have like a towel or something there while you're doing the oral care, because so it doesn't, you know, mess up your new stuff. And I'm just showing like the mouthwash and everything for that. So yeah, so I'm pretty sure this is coming to an end because I think we're about done with that. But I hope you guys enjoyed this video of me practicing in the lab, and I'll show you guys what my grades are looking like for the exam and the quiz that I took. Thank you. Okay, so after lab, after we got finished practicing in the lab, we got an update on our grades, and that is what my grade is looking like for both classes, and I'll get into it in the next clip. Okay, so with those grades, I could have did a whole lot better, which I am going to do in the upcoming, on the next exam. I'm going to do a whole lot better. But with that, I just say, you know, do better next time for me. But I know for some people, like, C's get degrees, but I can't really afford to make any C's. So we're going to aim high, not low. So I do thank you guys for watching the week of a life of a nursing student. Don't forget to like and subscribe to my channel, and don't forget to hit the post notifications so you can be notified once I upload a video. And we're on the road to 100 subscribers, so I'm excited about that. Don't forget that once I reach 100 subscribers, I'm going to be giving away my pink Littman that was in my nursing school supply haul video, and along with other items I think you can use for nursing school. So don't forget to like this video, and don't forget to subscribe to my channel and comment down below. So thank you for watching. See you in the next video. Bye.